Thank you so much for joining us in this program brought to you by Sawa Network. It's a program that brings to you ordinary South Sudanese doing extraordinary things, and this program is known as Leaders in Focus. Today we are dealing with one issue which is a very serious issue in South Sudan, but very few people talk about it. Our guest is Aluel Manyang. Welcome to the program.
Thank you.
Tell us a little bit about yourself.
My name is Aluel Manyang. I am a physician assistant by training, and I am also the CEO of Youth Care South Sudan. It's a health organization that focuses on HIV and AIDS awareness and research.
Yeah. So tell us a little bit about the seriousness of HIV/AIDS in South Sudan.
HIV and AIDS is becoming a serious matter, and that is it is indicated by the statistics. So when you look at it generally, South Sudan has a prevalence of 2.5%, but again, it's variable across the country. There's some regions that have about 6.8%, and then there are also regions that have about 4.0, others have 3.5%, 3.1%, and so forth. And so this is basically not representative of the actual prevalence. And then it is correct to say that there's so many people that are out there and do not know their statuses.
So this is basically the people who have come to the hospital in a way.
Yes.
And they've been tested.
Yes.
And it has been found. But there could be more people.
Correct.
What do you think, or what, according to you, doing your work, are the problems that are making this HIV prevalence to be a problem in South Sudan?
Well, for starters, there's lack of knowledge on the disease. We could say that there's so many people who do not know about the disease. Also, there's stigma. People who are aware, but again, we know that HIV is a disease that is associated with stigma. So if I know that I'm going to be discriminated, I will fear to go to the hospital to get tested, and so that's why there's so many people who don't go to to the facilities to get tested. Also, lack of accessibility. There are some regions that don't have health facilities, where people can go and get tested. There are also regions that are that have very poor infrastructure. So those are some other things that are hindering people from going to hospitals to get tested and know their statuses.
So as an ordinary person doing extraordinary things, what are you doing as youth care organization?
Currently, we are doing a research among the young people. We're doing a baseline studies to understand if they really know about the existence of the disease, and if they know how to prevent themselves from contracting the disease. And as it is a subject that involves human subjects, so we had to get an approval from the Ministry of Health, and we've been given that approval, and now we are executing.
Now, what do you expect after doing the research? What more are you going to do?
The research is actually going to give us a clear view on what is out there. So if we find out that people know about the existence of HIV, and then we will have to look at why is there increase in the incidence. As currently the incidence is at 1.56%. So it will give us a clear view on the loops that need to be filled in order to eradicate the disease.
Let us go for a short break. We will just be back. Don't go away. Welcome back. You are still watching the program Sawa Network, and it is a program that brings for you ordinary South Sudanese doing extraordinary things. Today, of course, our guest is Aluel Manyang. What are some of the challenges you are getting as you are carrying out this research?
funding is a big challenge. First of all, the government hasn't put so much into the health system. Currently, the budget, financial budget, was approved, and the Ministry of Health was given only 1% of the budget. That alone is not able to cover for services in HIV and AIDS, all right, let alone the whole health sector. So basically, there's a problem of funding. It's been neglected. And then also from the international organizations, currently they are more invested in doing prevention. In treatment services. All right, so a lot more of treatment that's being done, but then also there is awareness that's being done in vulnerable groups. But the youth, I feel like they have not been prioritized, and that's why we decided to take that age bracket. They are the future leaders of tomorrow. Yet again, they have not been prioritized when it comes to the sensitization, and that's why we decided that youth care needs to focus on the youth.
Now, the country, of course, still has challenges to do with issues of security, and many people are also in internally displaced persons camps. Do you think people being put, in those camps are also in a way maybe, increasing the prevalence of HIV/AIDS?
Yeah, we know that in a country that has war, the health system mostly cripples. Moving from one place to another, first of all, for those that already are infected, have a positive status and are on treatment, when war breaks out. Yeah, so there's this movement from one place to another, and so there is the follow-up on treatment. Some people, they miss their treatment, and others stop taking medication because obviously when they run out and they are in a place that don't have facilities to be able to get refill, and then they will obviously not have any medicine to go on. And so war affects, and then as well security means that the private sector, the international organizations, it hinders the movement of people in certain regions that could provide care. So war has a great impact on the issue, on the health system.
What about how serious is the issue of stigma? You mentioned it earlier. You said some people fear because there's also the problem of stigma. How serious is the issue of stigma in relation to HIV/AIDS?
The issue of stigma is very, very, very serious, and it's one of the serious matters that people with positive statuses face. One, if I am known to have HIV, people do not want to associate with the person anymore. That mentally, it tortures the person. And this is in most cases what actually kills these people. It's not even the disease, but it's the emotional and the mental impacts of stigma that actually kill these people. There's a friend of mine that was in high school who had a friend that was HIV positive. She got the disease from her mother, and she wasn't told about it. And when she finally was told about it, while she finished high school, she died 2 months after she was informed. And so it's the emotional and the mental that really, if they don't get the support, if they are isolated, that will kill them faster than the disease itself. Because there's this medicine right now that if you take your medicine appropriately and consistently, and you feed well, diabetes will even kill you before HIV kills you.
Yes, we are going for a short break. We will just be back. Don't go away. This is Sawa Network program. Welcome back to the program Sawa Network. Today we are looking at issues on HIV/AIDS. What would you think is the right thing to do for the youth of South Sudan who are really exposed to HIV/AIDS now?
Sensitization. It's as simple as that. If you give them the knowledge, they will be well prepared to protect themselves from contracting, because the main way that people get HIV and AIDS in South Sudan is through sexual intercourse with someone who is infected with HIV. So, and you know, it is always said that prevention is better than cure, and that's what we are trying to do at Youth Care. Make sure that we prevent, we give the people the knowledge to be able to prevent themselves from contracting the disease, then get infected and then put on treatment. So it's not the same. So prevention always, and that's why awareness is very important, and it needs to be done, and it needs to be done now.
I know that many of the donors to South Sudan now say they are only focusing on humanitarian assistance, and they are not now focusing on things like HIV and so on. What would you like to tell them?
Well, first of all, I'd like to appreciate the efforts. There are a number of organizations, there are a number of donors that put in money. Global Fund is one of the big donors. There's PEPFAR, it's a US fund. First of all, I'd like to appreciate them for what they are doing so far. And I also like them to know there's a lot more that needs to be done. Because when you look at the statistics, there is a target, UNAIDS target by 2030, that by 2030, HIV needs to, there's a 90-90-90 target. That means 90% of the population by 2030 should know their HIV status. And 90% of those people that know their status be put on treatment. And 90% of those who are on treatment should have a suppressed viral load, such that if your viral load is suppressed, in some instances, you cannot spread it to the next person. So that's the target by 2030. But when you look at South Sudan percentage as of 2018, it is at 24% people who know their HIV status. 24%, and out of 90. That's very low. 16% were on treatment. That's low. And so there's so much more that needs to be done according to these numbers that we have.
As Youth Care organization, what is your target in the next, for example, 5 years?
In the next 5 years, we would like to have at least sensitized about 80% of the population on the existence of the disease, giving them ways on how to protect themselves, and also sensitize them on the preventive methods and the available resources and treatment. And we would also like to have decrease discrimination against people living with HIV. So those are some of our targets.
Okay, now, how do you intend to achieve these targets?
So one thing that has to be done, because right now our main focus is sensitization and then research. So sensitizing people will help them to make the right decision. This is a matter of life and death. So sensitizing means that we come up with strategies on how to deliver the information. It could be done through school visits. We'll have maybe road drives with the message, and community, mobilized and sensitized on that.
We are going for another short break. We will just be back. Don't go away. The program is Sawa Sawa, and it will just continue on the other side of the break. Welcome back to the program. Let's continue with our discussion on HIV/AIDS in South Sudan. It would definitely also require you to have some, counselors and so forth. In that regard,
it's a big sector or department. So you need counselors, you need doctors, you need nutrition, because it's also it's important, very important for these people to feed well. So they need to be advised on how to live positively. We need the government. So basically, it's a wide department that involves everybody, because in one way or another it will affect everybody.
now you mentioned earlier about the issue of somebody who got infected through the mother. Now we understand that some youth are also infected because they got the disease during the time of them getting life. How serious is this problem in South Sudan, mother-to-child transmission?
Mother-to-child transmission has been reduced in the past years. There is what is called prevention of mother-to-child. A mother is put on ARVs, and the child as well. Children born to mothers that are positive are put on treatment right after birth to also prevent the infection. So and there's so much that has been done, and to prevent the mother-to-child transmission. And as much as it hasn't completely been eliminated, because obviously there are always going to be mothers that are HIV positive. So, but at least there's been some development. There's been reduced mother-to-child transmission.
What about those who give birth in the villages, in the homes? Some people, not because the hospital is not there, but because they just don't want to go. They say, I gave birth to one child from home and I have to. What do you tell them?
The Ministry of Health and some organizations are already working on that, because of the fact that mothers there are mothers that have HIV, and there's some important things that are supposed to be monitored during pregnancy. One of them is every mother is tested during pregnancy to make sure that they are not infected, and if they are put on treatment. And the government has been doing so much awareness on that to encourage all mothers, as long as they can access health facility within the region, to ensure that throughout their pregnancy they go to the health facilities, so that the pregnancy is monitored and made sure that everything is going on well and they are healthy. And to also assess the risks, because pregnancies are different. There are some people that are high risk, some are not. And so that section, it's being worked on, but obviously, because there are shortages, insufficiencies of services here and there, but every mother is advised to go to the hospital and get tested for all of that and prevent their child from contracting any.
And the youth also, because yes, you've talked about sensitizing the youth. Are there places that youth can go to and at least get information? Because you should not also just wait for information to come to you.
Right.
Sometimes you need to look for information. What would you tell them?
Right. So currently, the Ministry of Education has developed a manual on its sex education, but I believe it's still underway. I'm not very certain, but there's a manual that will be available to every student, and they can use that manual to enlighten themselves on STDs. There are also organizations like Youth Care. We go door to door to sensitize the young people. There are also a lot of messages that are being put out there by the different organizations and institutions that are working on eradication of HIV. There are billboards all over the place. And for somebody who wants to know more, the internet is there to educate themselves. But again, most importantly, you can go to any health facility that has a VCT, and they will get information from there.
Let's go for a break. We will just be back to continue with our discussion. Welcome back. You're still watching the program Sawa Network, a program that brings you leaders, and this is Leaders in Focus. Today we're discussing issues concerning HIV/AIDS in South Sudan. There is also a challenge because in some South Sudanese communities, issues to do with sex are not supposed to be, talked about. So
Right.
When you're doing your sensitization, what are some of the challenges you meet and how do you overcome them?
Obviously, there's that one that you just mentioned. Some communities and some people take it as spoiling the innocent young ones, because you cannot talk about HIV without talking about sex, because that's the most most route of transmission. And so it is very challenging, but so it's a negotiation as well, between communities and the health sector. So there is this, there's HIV, and then there's the practice. But again, when you look at it, they're already having sex anyway, because then if they weren't, they wouldn't be getting infected. So there is negotiating and availing the information and leaving it up to them to decide, on what to do. So what we are trying to do is just avail the information, and then the decision is up to them. But we don't intrude, we do not force, we don't enforce on them to.
What's your final say about HIV situation in South Sudan? Basically, a summary of what you've told us.
So HIV and AIDS is real. And the people need to work together, because then, what they say, one hand cannot clap itself, but two do. So we need to join hands and fight together, because only one sector, it's a multi-sectoral health system basically is multi-sectoral, like it needs all the sectors to be able to advance and provide services. So basically everybody needs to accept that it is real and it is increasing. As much as the percentage is not as high as compared to other countries, but it is increasing. That is what is worrying people. It's increasing at about 1.56, like I said earlier on. And so we need to stop that. We need to make sure we reduce it or we completely stop it. And everybody needs to put hands together and work to eradicate.
So there you've heard it, HIV prevalence in South Sudan is increasing, even though the percentage may look low now. The prevalence is increasing, which is a concern. And our guest today has been Aluel Guy Manyang. Thank you so much for taking your time to talk to us, and we hope to once again at one point talk about some issues affecting South Sudan. Thank you.
Thank you for having me.